A very warm welcome to Smart 24 TV if you're just joining us and you're watching SMB Smart Means Business with me, RITAH KABANYORO, and at this particular moment, that's where we dive into our discussion of this particular morning, where we're going to be creating awareness for hepatitis. And discussing this with me this morning, I'm joined by Kenneth Kabagambe, who is the founder of Africa Hepatitis Initiative. A very warm welcome. Thank you for coming through, Kenneth. Good morning.
Morning, Rita. And morning, our viewers.
Very well. If you could now shine a light on hepatitis.
Well, hepatitis simply comes from two Greek words, which means hepa, referring to
stomach.
Liver.
Then, I was seeing you touching stomach.
Liver, then titis, meaning disease. So hepatitis in simple terms is a liver disease. And this liver disease can be caused by so many things actually. For example, toxins, alcohol, we have alcoholic hepatitis.
Okay.
Then we also have hepatitis, which is a result of viruses. And mainly today we are going to focus on hepatitis, which is as a result of viruses.
Okay.
So when we talk about viral hepatitis, we refer to about 5 types of hepatitis. So we refer to hepatitis A, B, C, D, and E. So when you look at these 5 types of hepatitis viruses, they are transmitted differently, and also they affect the liver and the person generally differently. So hepatitis A and E are transmitted the same way as cholera.
A and B.
A and E.
A and E,
yeah,
are transmitted like cholera.
So if you are staying in an unhygienic place with poor sanitation and also eating fecal matter of someone who has hepatitis A and E, then someone is going to likely to have these viral infections.
So A and E, let's first dive into that, is on to sanitation matters,
sanitation
like cholera and hygiene.
Issues.
Okay.
So basically that is A and E. Now, when we come to hepatitis B and C, those are transmitted through blood. So hepatitis B is more or less transmitted like HIV. So let's say sharing contaminated sharp objects, transmission of mother to child. If a pregnant mother has hepatitis B and at birth, the mother is likely to actually transmit the virus to the newborn baby, especially during the cutting of the umbilical cord. And there is blood contact between the mother and that of the baby. Then also we have looked at issues to do with blood transfusion. So blood transfusion can also transmit hepatitis B, especially if the transfused blood has the hepatitis B virus. But the beauty with this that is in Uganda, the Uganda Blood Transfusion Services is actually at the top of things, because each blood that is being transfused to patients is screened for diseases like hepatitis B, HIV, syphilis.
They screen it before.
Yeah. So we can assure the general public that the blood that is being transfused to patients in hospitals, that one is free of hepatitis B and C and other diseases, so it is safe blood.
Okay, just to interject there, Kenneth, what if the patient who needs blood is already hyped? How is it even called? Is it hyped, already suffering from hepatitis?
Yeah.
Okay, is already an hepatitis patient. And then the blood that is coming their way is also infected. Is there a need for, screening it or even changing blood?
Of course, like I've said, with Uganda Blood Transfusion Services, and the blood that is being transfused is already cleared of these infections. Okay. So there is no way they can transfuse blood which already has the virus, or maybe hepatitis or any other viruses. So that one I may not dive into it so much, but that is it. But also to emphasize that hepatitis B is not transmitted through casual contact. Because most people have actually been having a lot of misconceptions when it comes to the clear mode of transmission. Some say hepatitis is transmitted through sweat, which is not correct.
Very.
Yeah, so hepatitis B is not transmitted through sweat. through sharing utensils with the household, maybe that has someone who has hepatitis. It is also not transmitted through sharing clothes with someone who has hepatitis B. So what this actually means is that there should not be need for someone who has hepatitis B to be discriminated against.
Okay.
Yeah, because that kind of discrimination also might lead to mental degeneration and cause other, unexpected results.
Okay.
Yeah,
and we are still into understanding hepatitis, Kenneth. You highlighted about sweating.
Yeah, sure.
And my colleagues, my friends and the people who are around me, those are some of the things they have in their mind. Because we were even going onto a taxi and then you don't want someone, someone's body to touch on you. You feel like you're going to get hepatitis.
Yeah, of course, I think all that is as a result of low awareness and education in the public, even by the amongst health workers. We still have a certain class of health workers who think like the lay people, that hepatitis is either transmitted through touching the patient who has hepatitis, through sweat and all those other things, which is not actually correct.
Okay.
And that's why actually I take the opportunity to thank Smart 24 TV for giving me the opportunity to come and
clarify. And we are here to create awareness. Sure. Very well. And we were on hepatitis B.
Yeah, so hepatitis B. So hepatitis C is also transmitted the same way as hepatitis B. The only difference that exists between these two viral infections is that for hepatitis B, it has a vaccine. So if you test for hepatitis B and you are found to be negative, you can opt for a vaccine which prevents you from getting it in the future. But for hepatitis C, it has no vaccine.
Okay.
That is the difference that exists between the two. But again, also hepatitis B for now has no cure, while hepatitis C has a cure.
Okay.
Yeah. So those are the two differences that really exist between the two viruses.
So B has cure and has a vaccine.
B has no cure but has a vaccine.
Okay.
While C has no vaccine but has a cure.
Okay.
Yeah,
okay.
So those are the things that we need to be very sure about.
Okay.
But also when it comes to diagnosis or testing of hepatitis B and C, there are a number of things that are supposed to be considered to confirm exactly whether someone has hepatitis C
or B
or not. Oh, no, with B, it is just a test, like a rapid test, like you can do an HIV test. Okay. And you know that, I have hepatitis B or I don't have it.
Okay.
But of course, at that stage, you may not be put on treatment until you do other tests, which we shall go into after.
Okay.
So with hepatitis C now, what happens is that when you test with a rapid test, or the strips that they use, and you find
that involves pricking and getting blood sample.
Yeah. Okay. So when you test positive, at that particular moment, they may not actually confirm whether you really have hepatitis C and whether you need the treatment. So there are a number of investigations like the PCR test, which is a bit sophisticated and done in bigger laboratories, not the smaller laboratories. So when you go there and they do the PCR, they also need to do the genotyping. The genotyping helps in identifying which drug, because each drug responds to each particular genotype. So that helps in identifying which genotype you're suffering from and which kind of medication you're supposed to be given.
Okay.
Yeah, so basically
which brings me to a point where I want to know, how do they test for hepatitis? I know but you are experienced with that, because for example, as for pregnant women, like if they are testing hepatitis, they just go, okay, we're going to get your test.
Yeah.
But they don't explain to you which hepatitis B, which hepatitis are they tested. So they just tell you you're negative, and then you see someone coming to inject you, they inject you.
Sure.
So how can we know which one have they tested or not? Or is it a general test?
I think it is also a mandate for the patient. I will put it as a patient. You might not be a patient, but for the person who requires,
who is receiving,
or who is doing the tests, to actually ask exactly which tests they want them to be done. But for the pregnant women, actually there is a policy that Ministry of Health has passed. So every pregnant mother has to, during their antenatal visits, they have to do hepatitis B tests. Unfortunately, the challenge in that is that most of the antenatal clinics are not doing it, not because they don't want to do it, but they do not have the test kits to do the tests. So, of course, maybe there are some pregnant mothers who go to private health facilities and they are very cautious about their babies' lives. So, for them, they ask privately to have these tests, and they are done. So, if a pregnant mother is found to be positive, then there are a few precautions that are going to be taken, so that the baby does not actually get the infection. Because most of the people actually who get hepatitis in Africa get it at birth.
And that means hepatitis B is viral.
Excuse me. It's a viral infection.
Okay.
Hepatitis B is a viral infection. And most people actually who progress to have a lifelong infection, what we call chronic infection or chronic hepatitis B, have it when they have gotten it from 5 years and below. Because from 5 years and below, the immune system of these children is very low to fight the virus. So what happens is that they proceed to be lifelong carriers for hepatitis B. And that's why WHO has actually come up with a policy to ensure that all newborn babies are vaccinated or are immunized within 24 hours
of
birth.
Immunization with the hepatitis vaccine, or just the general immunization?
The hepatitis B vaccine. So they're supposed to be given a hepatitis B birth dose within 24 hours, so that they protect these children.
Regardless where you've had the baby from, government or private?
Like any other vaccines, because I know our government is supporting other private health facilities with these vaccines, especially when you see the immunization expanded program on immunization, EPI program, so which covers the other vaccines. So apparently Uganda is not actually administering a birth dose, but I'm glad to also inform the viewers that the goodwill is there. The Ministry of Health is actually taking lead to ensure that this is actually something that the country has to go through. And I know in the near future we shall be having the birth dose introduced in this country.
At least there is hope portrayed there.
Yeah, sure, there is
hope.
And also Gavi, which is one of the biggest sponsors of these vaccines, has actually also reviewed its strategic framework for 2021, 2025, and they are going to support the birth dose. So they have only been affected by the COVID pandemic, so they have not been able to roll this program due to the challenges surrounding COVID.
With this pandemic. And surely, at least now we have the light on A and E, then B, and then C. And then is there any other?
D.
Okay, D.
So now with hepatitis D, those people who have hepatitis B virus are the only ones who can get hepatitis D.
Those with only hepatitis B.
So hepatitis D coexists with hepatitis B. So if someone has been vaccinated against hepatitis B, then this person will never get hepatitis D.
So what are some of the signs, symptoms, or causes of D?
Of course we shall talk about the general, because these viral infections actually have almost similar signs and symptoms.
Okay, before now we go to the general, if we were to talk about the general, shine a light on the alcoholic hepatitis. Let me take you back to alcoholic hepatitis.
So with alcoholic hepatitis, basically this is hepatitis or liver disease that comes out of alcoholic addicts. So people who have been addicted to alcohol for so long, you know, there are some people who cannot like spend a day without taking alcohol. So when you take that alcohol frequently and in larger quantities, it damages the liver.
Does it matter which alcohol? Is it crude weight as long as it's alcohol? Okay.
It will damage your liver, you know, in the process. So this kind of damage that it causes is what we call alcoholic hepatitis. So it results, it is a result of high consumption of alcohol for a long period of time, like people who have been addicted to taking alcohol. So basically that is what we call alcoholic hepatitis.
So how dangerous is alcoholic hepatitis?
It is as dangerous as the viral, because in the long run it will damage your liver and create a situation which is called cirrhosis, liver cirrhosis. So liver cirrhosis can be, say, scarring of the liver, or it can also cause a condition called ascites. So ascites is a condition where the abdomen keeps on accumulating fluids. So you find someone's abdomen is, you know, swollen, and each time they keep on sucking the water from the abdomen.
I understand that. That means the alcoholic hepatitis is not transmitted.
Yeah, it is not.
It is owned as an individual. You have brought it yourself. You own it.
You are absolutely right.
Okay.
But the other viral infections, those ones are actually transmitted.
Okay, then let's look at the general symptoms.
So basically, hepatitis is a silent killer.
Okay.
And why we call it a silent killer is because its signs and symptoms, majority of people who have these viral infections may never experience the signs and symptoms. And that's why we call them, you know, silent killer. And also again, you know, some of the mild signs and symptoms are like for, say, malaria, typhoid. So when you feel like these malaria, typhoid symptoms, you go check up for malaria or typhoid and you don't have all the two infections.
Yeah, sometimes people go to hospital, the malaria temuli, typhoid temuli, and then they go,
maybe yeah, sometimes people, especially those with quarrels, maybe with the neighbors, they will end up saying, oh, maybe they have bewitched me, something like that.
So you mean we have to take extra caution and then go for hepatitis?
Exactly, yeah, because majority of the people never take hepatitis as a serious, you know, infection. So it is upon this background that they need to. So, like I've said, some of those signs and symptoms are almost the same as those of malaria.
Okay, then typhoid. Does it go on its own? Because if
in some cases, so we have what we call acute hepatitis.
Okay.
So acute hepatitis is a short-term infection that comes and then goes when the body immunity is actually fighting it off.
Okay.
So when you have a strong body immunity, it will basically fight, and during that kind of fight between the virus and also the immunity, that's when someone experiences those signs and symptoms like the fever, joint body weakness, yellowing of the eyes, which is called jaundice, also loss of appetite, vomiting. But then we have what we call advanced signs and symptoms.
That's when they say you're in an advanced stage.
Advanced stage. Now, with these advanced stages of hepatitis infection, you'll find that someone still has what I was talking about in regard to alcoholic, you know, hepatitis. Someone has a swollen belly. They have developed cirrhosis, scarring of the liver. They have developed a condition called ascites. Then they have also developed HCC, which is hepatocellular carcinoma. So hepatocellular carcinoma is basically a liver cancer. So, and when someone reaches at that stage,
It's really advanced.
it's really very bad, and we wouldn't really want anybody to reach that stage, because that is the deadliest stage, which may not actually be reversed in most cases. And a few who might afford a liver transplant, liver transplant is just changing the liver, getting a new.
And that's very expensive.
Yeah,
I mean,
so
how many of
course,
us can afford
you
a
need,
transplant?
You need about 35,000 onwards, 35,000 US dollars onwards, which is a very huge chunk of money that majority of Ugandans may not afford. So basically, we urge everyone to test, because once you get to know your hepatitis status early enough, the doctors can do something to really help you live. Of course, not everyone who has hepatitis B is going to face those challenges, as long as you have known early, because there are some specific don'ts
And do's and don'ts when you have
hepatitis.
Okay.
So once you understand those do's and don'ts, then you can live for so many years without having any problem with hepatitis.
Okay, just as we want to leave on this particular one on to understanding hepatitis, then we move on to the next. How, I mean, convince us, like if I do not know my hepatitis status, I will be facing the worst, because people feel like they're comfortable.
Yeah.
Whether I have gone for the test, whether
Yeah.
I have gone to know my status. I mean, how bad is hepatitis?
You see, 80% of liver cancer cases registered at the Uganda Cancer Institute as a result of hepatitis B. That is how bad it is. And cancers, honestly, cancers are one of the most disastrous diseases that Ugandans, Africans are facing lately. And of course, this is because they manifest slowly, and when they have reached their advanced stages, like I've said, there might not be anything that the doctors will do to reverse the conditions. So that is why it is very important for everyone outside there actually viewing this program to take the initiative of ensuring that they know their status. Once they know their status, they can be advised on what to do. If you don't have hepatitis, you can go vaccinate. And actually, by the way, the Ministry of Health is currently providing these vaccines free of charge. Even in Kampala here, if you go to a public
government,
health,
yes, at least I am aware of that.
Exactly. So, of course, this is information that is not in the public because COVID has overshadowed all the other programs.
And we will get there.
Yeah. So there is vaccines. There are vaccines in public and some private health facilities. So it is the mandate of everyone to go and seek these medical services. Okay.
Can I say that, am I right to say that there is only one vaccine for hepatitis B, is it?
Yeah, of course.
Since you said it's the only that can be vaccinated.
Yeah, even hepatitis A can be vaccinated.
Okay.
But hepatitis A and E actually are not so severe. For them, the body can actually fight and clear them off. So that one, you don't need to bother so much about them. Especially hepatitis E in pregnant women becomes a disaster because it causes a lot of dehydration and can either cause, kind of premature miscarriages.
Okay.
Yeah. So it becomes a problem in the pregnant women. But other than that, the bodies have always fought them. And there was an outbreak of hepatitis E in districts of Nepal.
That is northern.
That is the Karamoja region.
Karamoja region.
Yeah, and the reason the researchers were giving is that some villages in those districts prefer not to use the toilets. For them, they use the bush.
Yes, so just because in most of the areas actually in Karamoja region do not have toilets. I can testify on that.
Yeah. So basically that is, and the water sources is contaminated with this, and that's why they have been having that challenge. So basically that's it. Hepatitis is real,
Okay.
and we need to take it very serious, because if you look at the global statistics, hepatitis B and C, actually viral hepatitis in general, accounts for 1.4 million deaths globally, and this is far higher compared to the people who succumb to HIV, malaria, and tuberculosis. So someone will be asking that now that this viral infection has a lot of mortality rates globally, why isn't it being given a lot of attention like it is for HIV, malaria, and tuberculosis? So we shall maybe get
and we will be getting there, Kenneth, after the break. But before we take a break, is there any local understanding of hepatitis? Like, for example, maybe kokolo, if we were to put it towards
in the local dialects. So
kokolo is cancer, I guess.
Yes, sokati maybe we can say it is kokolo wechibumba.
Kokolo wechibumba.
Oba obulwadde bw'ekibumba, oba some other people say omusujja gw'ekibumba.
Musujja gw'ekibumba.
Because
it causes fever.
Yeah, I've had that in some people, but I think the best that will raise people's
attention is kokolo
wechibumba.
Okay, kokolo wechibumba. That's more really creating awareness, more of saying cancer wechibumba.
Right.
But like you said, 80% of
liver cancer,
is manifested from hepatitis. So surely we can be right to say kokolo wechibumba. We do take a break, and we do return and talking more about the rate of hepatitis in Uganda, and also surely giving you hope, or giving us hope regarding hepatitis. It's not the end, and you're never too late to actually go and rate out your status and also get treatment. Let's take a break. We do return shortly.